My name is Lucia Machova. I came on board Kidzpositive in 2004, firstly as a patient, after I was diagnosed HIV positive in December 2002. I was a domestic worker then, and then one thing led to another. I lost my job, and then after that, Dr. Paul Rowe, who runs the HIV clinic, decided they needed somebody to do their data capturing, and that's how I came on board. The project runs a clinic, a family clinic for children who are HIV positive and their mothers. We have an income generating project where we do bids on a weekly basis, and we get paid up to about 150 rands a week. Many women are managing to survive, and they continue to survive with the money they get from the Kidzpositive income generating project.
Kidzpositive Family Fund was established by a group of healthcare professionals at Groote Hospital to serve the needs of families of children with AIDS. And in doing this, one of the main things obviously is in the medical sphere. But Dr. Paul Rowe, who was the main instigator of the fund, has a wonderful holistic view of looking after the families. And he very soon realized that people didn't have the money to come to the hospital, they didn't have money to feed their families.
When you treat a child for HIV and AIDS, you do it as part of a team. Every member of the team has to be equal to every other member, otherwise it isn't a team. And it means that the mother must be an equal member of a team. That is really, really difficult if your home circumstances are chaotic. If you are poor, if you are stigmatized, and if you're just struggling to live from day to day. What we are engaged in HIV is secondary prevention. Children have already got the disease, but we are trying to prevent the complications and the aggravation of the condition. And in my mind, a beadwork project, an income generation project, is a very direct and immediate way of supporting a family in their socioeconomic problem.
The entry point for someone to be on the project is that they have had a child with AIDS admitted to the paediatric ward at Groote. That may mean that the child and the mother have a fairly prolonged contact with the hospital at that stage, and then the mother is offered the opportunity to learn how to do the beadwork.
Only the most desperate, really the poorest moms take on the project. It's interesting that once they've been in the project for some years and we don't have any exit strategy, they're probably not the poorest moms in the project anymore.
Kidzpositive means a lot to me because before I joined the Kidzpositive, I have nothing to eat and I have no money, no income, except the grant.
My name is Busaswangele. I'm 38 years old. I'm married and I've got 2 kids. I met Kidzpositive at the time my baby was very sick and she was hospitalized. We have to stay there for 3 months. So she was having TB. When I started my beadwork, I started saving money, and I was staying in a one-room house. I decided to extend my shack, so it was those 2 rooms that side. So I bought my cupboard. I saved money again, and I bought this. Kidzpositive helped me a lot. They are my family.
Sometimes the child can also be
One of the important things, I think, is it works totally in parallel with the HIV/AIDS family clinic. We are totally integrated with the clinic, and there are so many other things going on.
The mothers, they don't know what to do. So when we group them, they are sharing their ideas. They support each other, and they make them strong, because those who are weak, they get strong.
Before, the children coming to the hospital were literally dying of AIDS. So for the medical staff, it's been wonderful that they can really help those children, and they now actually are not only recovering, but they're thriving. And whereas they were babies, we've now got adolescents, which brings a whole new range of challenges.
My name is Coletta Machova, Lucia's daughter. Me and my mom, we help each other in the bedding. Helps me a lot to clear my mind. I always do it sometime when I get time after school. The Kidzpositive clinic is my second home. When I'm there, I feel at home because I know everybody. I know the doctors. I understand more of my virus, and I'm quite comfortable. It's my second home.
The only time when I think about my status is when I take my medicine and I do my bead work. It's the only time I talk to the virus. I just made it my time to talk to the virus and tell it how I feel and what I wanted to do. I don't know, I've got this thing in my head that tells me that I'm in control of the virus.
The schools initiative has become a really important part of the sustainability of the project. In fact, the project owes its origin to the schools. And I think they've had fun because in many of those cases they've gone online and designed their own beadwork pins. A special design was developed for us called the Star of Hope.